Welcome back, everyone. Every Indian male over the age of 40 is a heart patient until proven otherwise. 40 is the new 70 when it comes to heart issues. The warnings coming from Indian doctors over the last couple of years has been fairly dire. Why is that? It's something we are talking to Dr. Tehran, one of India's best-known cardiologists, on a day when we call it, the Heart Day, as it were. Thank you, Dr. National Heart Day, as it were. Dr. Tehran, thank you very much for your time here on Mirror Now. I want to ask you, do you agree with this when we are told by doctors, top-line doctors like you, that every Indian male over the age of 40 is a heart patient until proven otherwise? Are things that bad?
I think that might be a little bit of an exaggeration or an overstatement. Just, but the point is, it does not take away from the fact that India or Indians have double the rate of heart attacks or heart disease than our Western counterparts. So that's a pretty alarming data. Okay. Now the question basically is that today, rather than scaring everybody, we are now getting into what we call predictive medicine. We can now actually, with genetic history, genetic analysis, biomolecular analysis, we can actually tell people who are at a higher risk for heart attacks and who are not. So that if you tell the whole world, don't eat anything, don't do this, don't do that, the traction is very little because, people say we want to live. However, if you can identify the people, this is sort of what we are doing. At Medanta, we started this whole predictive medicine model, where we can tell not only for heart disease, for diabetes, for even some cancers. The analysis will now tell us exactly that algorithm that is being developed, that who are the people at risk. And if you warn them and show them the mirror to say, and I'm saying it on Mirror now, that if you show them the mirror of their genetic makeup and propensity for developing heart disease, they'll pay attention. The whole thing is to be precise, not to be so general that it is not believed by people that how can you say all of us are heart patients and proven otherwise. It's a little bit of an exaggeration, but not to take away from the fact that there are alarming signs around us.
So, okay, I understand you're saying that one statement may be an exaggeration. Is it also an exaggeration to say that 40 is the new 70 now when it comes to heart diseases / heart attacks? Because look at what we are seeing around us, Dr. Tehran. And since it has happened to people who are in the public eye, this becomes a talking point. You have someone as young as a 40-year-old Siddharth Shukla who dies while he's exercising. He has a heart attack. You have, the same thing happened to Raju Srivastava. We have the same thing happened to a string of other celebrities, both in North India and South India. So is it fair to say that heart problems are coming to us at a much younger age now?
Yes, that's true. That's very true. The fact is, like I said, one, we have genetic propensity. Then you use tobacco a lot. Either smoke or chew tobacco. Third, our diet is full of fried food. We have no discretion in our diet. Fourth, we don't exercise as generally as a population. Now, this is a recipe for disaster. So that's when I said, especially if you have a genetic propensity. That means, that's why we say today, know your genes. You know whether there is heart disease in your family or not. And where is it? Your mother, father, uncles. So if you have heart disease in the family, we recommend today that before the age of 25, you must have a complete checkup for associated risk factors. And we can actually guide the person to stay within that band where they can expect to be able to live without fear of heart disease, at least to a great degree, much more than if we did not warn them. So I'm saying today, one, we have to be conscious as a population first. And then the doctors have to give the right advice. If we either go in either direction, if we do underwarning, then we are doing a disservice because the person may lose their life. On the other hand, if we do scare tactics, then the person may actually either become a cardiac cripple or say to hell with it. So doctors have to be the right proportion and do it in a way that the patient believes that they are getting the truth about themselves. And like I said, we have the tools today to be able to accurately tell an individual on what algorithm they reside, where is that curve in their life, and then we can work around it.
Dr. Tehran, then help me understand this. One of the problems you say is that Indians simply don't exercise. There is no culture of exercising when it comes to most of India. But can over-exercising be a problem as well? Because, in multiple cases that we have seen, and these are, of course, stories that have played out in the public space because of which we are talking about this. Say someone like a Siddharth Shukla, who's on our screens right now, he's 40 years old, has good habits. We don't know what his genetic history is as far as heart issues are concerned. But here is a guy who was actually exercising when he had his heart attack. Is there a link between over-exercising and heart issues / heart attacks?
Yeah, but I will qualify with one statement that it is relative. If you already have pre-existing heart disease, over-exercising will definitely be a very, very big danger. If you do not have anything in your coronary arteries, they are clean, and you do not have history of irregular heartbeats or your heart muscle is not thick. So all these things are linked to what is the underlying factor. So over-exercising is bad anyway, not only for your heart, but for your muscles, your bones, your whole hormonal system. But somehow people have gotten into like big muscles, like biceps and triceps. They think is attractive, but it's not. I'm not even sure there are enough intelligent people around you who will say, yeah, this is really looks good. So I'm saying that it is stay away in the middle from all these extremes and be in the middle of the stream. And we have prescribed very clearly. You should not go more than 1.5 times your resting heart rate. That is your maximum limit. And you should exercise in that period. You can do it for a longer period. And you should do it regularly. That's much better than trying to overdo it. Now, if you are a marathon runner and you have trained yourself over a period of time, then it's one thing. So now you need to also figure in that COVID has turned the world upside down.
Yeah.
That has introduced a new stream of risk factors. So what we've discovered, it was actually done by the Italian doctors who did autopsy on COVID patients. And they found that the virus is everywhere in our bodies, not only in our lungs. And they found that the heart muscle was getting inflamed. So very quickly, we developed the means in our tools, like MRI and thallium scans and all that, to see how we can identify the vulnerable people who should not be exercising yet, because there is swelling in the fibers of the heart muscle. We call myocarditis. So in patients who have the inflammation, we have the means of suppressing it. But unless we do that and you clear somebody for it, they should not go into heavy, or even if your COVID was 1 month ago or 6 weeks ago and you think you're feeling perfectly fine. So if nobody warned you, then you would say, what's the harm? I'm used to exercising, I'll do it. But that's where many people lost their lives in excessive exercise, and they miss the fact that they may have had inflammation of their heart muscle.
Okay. So, Dr. Tehran, silent attacks, I'm told, account for 25% of all deaths. All right, you're telling us that, look, anyone above the age of 25 needs to go for a full body checkup to see if there are underlying heart conditions. Can I just ask you, for those who are lazy and who haven't gone for that health checkup, what are the tell signs? I mean, a heart attack will come with some sort of warning, right? A heart problem will come with some sort of warning. What are those warning signs that we should be looking out for?
So, one is the classical angina, which not everybody will get, but if you are exercising or you're doing some activity or you are getting anxious, excited, and you start getting some pressure or burning in your chest, then that may be a sign that you are getting uh, angina, that means blockages in the arteries. Excuse me. So the second thing is that if you start getting short of breath doing activity, just like going up one or two flights of steps, or walking fast, or even slow jog, you start getting short of breath, you should be checked out right away. You'll be surprised that we did a study of 10,000 executives who came for a regular checkup, and in that we found that 26% of them had high blood pressure, which they were not aware of. So high blood pressure is also a silent killer. So we have to be very careful in today's environment where we are surrounded by stress. We are surrounded by a very bad environment around us, like the quality of air is usually bad. All these things add up to that the sort of putting a stress on the human body, which actually is skewing all the parameters that we had. So the only escape is that one should be getting a preventive checkup. In that preventive checkup, we can actually identify what is the pathway a person is following and what should we do to alter that. Today, the science exists.
Okay.
And I think that this is why I'm stressing again and again, you exercise right, you eat right, you de-stress. Now, nothing better than yoga and pranayam for de-stressing because there is stress everywhere.
Okay.
If you follow these things, that's the best you can do for yourself.
Thank you, Dr. Tehran. Good to have you on an important day like this, telling us what we need to do and what we need to look out for. So thank you very much for your good advice. Thank you very much, Dr. Tehran, for joining us. We are shifting our